Hepatitis. Hepatitis refers to an inflammatory condition of the liver. It's commonly caused by a viral infection. However, there are other possible causes of inflammation of the liver. These include autoimmune hepatitis and inflammation of the liver that occurs as a secondary result of medications, drugs, toxins, and alcohol. Autoimmune inflammation of the liver is a disease that occurs when your body makes antibodies against your liver tissue. According to the Centers for Disease Control and Prevention, CDC, approximately 4.4 million Americans are currently living with chronic hepatitis B and C. Many more people don't even know that they have inflammation of the liver. In particular, treatment options vary depending on which type of hepatitis you have. You can prevent some forms of inflammation of the liver through immunizations and lifestyle precautions. Causes of non-infectious hepatitis. The effects of alcohol and other toxins can cause hepatitis. Excessive alcohol consumption can cause liver damage and inflammation. This is sometimes referred to as alcoholic hepatitis. The alcohol directly injures the cells of your liver. Over time, it can cause permanent damage and lead to liver failure and cirrhosis. A thickening and scarring of the liver. Other toxic causes of inflammation of the liver include overdose of medications and exposure to poisons. Autoimmune system response can cause hepatitis. In some cases, the immune system mistakes the liver as a harmful object and begins to attack it. In particular, it causes ongoing inflammation that can range from mild to severe, often hindering liver function. Moreover, it's 3 times more common in women than in men. Common symptoms of hepatitis: if you have infectious forms of inflammation of the liver that are chronic, such as hepatitis B and C, you may not have symptoms in the beginning. Symptoms may not occur until the damage affects liver function. On the other hand, signs and symptoms of acute hepatitis appear quickly. Specifically, they include fatigue, flu-like symptoms, yellow skin and eyes, which may be signs of jaundice, dark urine, pale stool, abdominal pain, unexplained weight loss. Chronic hepatitis develops slowly, so these signs and symptoms may be too subtle to notice. Types of viral hepatitis: the 5 types of viral inflammation of the liver. Viral infections of the liver that are classified as inflammation of the liver include inflammation of the liver A, B, C, D, and E. In particular, a different virus is responsible for each type of virally transmitted inflammation of the liver. Hepatitis A is always an acute, short-term disease, while inflammation of the liver B, C, and D are most likely to become ongoing and chronic. Also, hepatitis E is usually acute but can be particularly dangerous in pregnant women. Inflammation of the liver A. Inflammation of the liver A is caused by an infection with the hepatitis A virus, HAV. This type of hepatitis is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. Inflammation of the liver B. Inflammation of the liver B is transmitted through contact with infectious body fluids, such as blood, vaginal secretions, or semen, containing the hepatitis B virus, HBV. Injection drug use, having sex with an infected partner, or sharing razors with an infected person. All of them increase the risk of inflammation of the liver B. It's estimated by the CDC that 1.2 million people in the United States and 350 million people worldwide live with this chronic disease. Hepatitis C. Inflammation of the liver C comes from the hepatitis C virus, HCV. It is transmitted through direct contact with infected body fluids, typically through injection drug use and sexual contact. In particular, HCV is among the most common bloodborne viral infections in the United States. Approximately 2.7 to 3.9 million Americans are currently living with a chronic form of this infection. Hepatitis D. Also called delta hepatitis, Hepatitis D is a serious liver disease caused by the hepatitis D virus, HDV. HDV is contracted through direct contact with infected blood. In particular, hepatitis D is a rare form of inflammation of the liver that only occurs in conjunction with hepatitis B infection. Of course, the hepatitis D virus can't multiply without the presence of hepatitis B. It's very uncommon in the United States. Hepatitis E. Hepatitis E is a waterborne disease caused by the hepatitis E virus, HEV. It is mainly found in areas with poor sanitation. Typically the result of ingestion of feces pollutes water sources. This disease is uncommon in the United States. However, cases of hepatitis E have been reported in the Middle East, Asia, Central America, and Africa, according to the CDC. Complications of hepatitis. Chronic hepatitis B or C often lead to more serious health problems. Because the virus affects the liver, people with chronic hepatitis B or C are at risk for chronic liver disease, cirrhosis, liver cancer. When your liver stops functioning normally, liver failure can occur. Complications of liver failure. Specifically, they include a buildup of fluid in your abdomen, known as ascites, hepatocellular carcinoma, which is a form of liver cancer, increased blood pressure in portal veins that enter your liver, known as portal hypertension, hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities due to the buildup of toxins, like ammonia, that affect brain function, bleeding disorders, kidney failure, death. People with chronic hepatitis B and C should avoid alcohol, because it can accelerate liver disease and failure. Certain supplements and medications can also affect liver function. When you have chronic hepatitis B or C, check with your doctor before taking any new medications. Treatment for hepatitis. Treatment options are determined by which type of hepatitis you have, and whether the infection is acute or chronic. Hepatitis A. Hepatitis A usually doesn't require treatment because it's a short-term illness. Bed rest may be recommended when symptoms cause a great deal of discomfort. In particular, if you experience vomiting or diarrhea. Follow your doctor's orders for hydration and nutrition. The hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages 12 and 18 months. It's a series of 2 vaccines. Vaccination for hepatitis A is also available for adults, and can be combined with the hepatitis B vaccine. Hepatitis B. Acute hepatitis B doesn't require specific treatment. Meanwhile, chronic hepatitis B is treated with antiviral medications. However, this form of treatment can be costly, because it must be continued for several months or years. In particular, treatment for chronic hepatitis B also requires regular medical evaluations and monitoring, to determine if the virus is responding to treatment. Hepatitis B can be prevented with vaccination. The CDC recommends hepatitis B vaccinations for all newborns. Series of 3 vaccines is typically completed over the first 6 months of childhood. Moreover, the vaccine is also recommended for all healthcare and medical personnel. Hepatitis C. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. Meanwhile, people who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. They may also need further testing to determine the best form of treatment. On the other hand, people who develop cirrhosis, scarring of the liver, or liver disease as a result of chronic hepatitis C, they may be candidates for a liver transplant. Currently, there is no vaccination for hepatitis C. Hepatitis D. No antiviral medications exist for the treatment of hepatitis D at this time. According to a 2013 study, a drug called alpha interferon. It can be used to treat hepatitis D, however it only shows improvement in about 25 to 30% of people. Hepatitis D can be prevented by getting the vaccination for hepatitis B, as infection with hepatitis B is necessary for hepatitis D to develop. Hepatitis E. Currently, no specific medical therapies are available to treat hepatitis E. Because the infection is often acute, it typically resolves on its own. People with this type of infection should get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. However, pregnant women who develop this infection require close monitoring and care. Tips to prevent hepatitis. Hygiene and avoid. Practicing good hygiene is one key way to avoid contracting hepatitis A and E. In particular, if you're traveling to a developing country, you should avoid ice, local water, raw or undercooked shellfish and oysters, raw fruit and vegetables. Inflammation of the liver B, C, and D that is spread through contaminated blood can be prevented by not touching spilled blood, sharing razors, using someone else's toothbrush, sharing drug needles. On the other hand, inflammation of the liver B and C can also be contracted through sexual intercourse and intimate sexual contact. Therefore, practicing safe sex using a condom can help reduce the risk of infection. You can find many options available for purchase online. Vaccines. The use of vaccines is an important key to preventing inflammation of the liver. Meanwhile, vaccinations are available to prevent the development of inflammation of the liver A and B. Moreover, experts are currently developing vaccines against inflammation of the liver C. A vaccination for inflammation of the liver E exists in China, however it isn't available in the United States. Advice. In particular, understand the causes and prevention of liver disease, so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action and start enjoying the benefits. Reference: The Free Solution for Fatty Liver. Or visit 247naturalhealth.com to all chronic illness information. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you. I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.